I hope y'all had a good Christmas and New Year's. I lost my voice over the Christmas holiday and for about a week. I wasn't sick or anything. It was very weird. I just completely lost my voice and I couldn't talk. And I was planning to do some lives over the holidays and it was just very quiet around my home. So anyways, I'm back now. So welcome. I'm glad you're here. I want to talk kind of more in a more general sense. And if you're if you have questions or if you have anything on your heart that you want to share, experiences, some of the ways that you have fallen through the cracks, frustrations, discouragement, go ahead and share it into the comments and I'll do my best to to pick them up and see them and then respond to them. And if you're new, you've never been on one of my lives, my name is Paige. I'm a nurse. I've been a nurse for 32 years. I'm a patient advocate now, so I help people navigate the healthcare system and all of the ways that people can fall through the cracks. That's kind of what I do now. So that's what my lives are about. That's what my videos are about. And if you haven't seen my videos, you'll pick it up pretty quickly where my heart is and what I'm passionate about. So, and if there's anyone on here who if you know someone that would value this, go ahead and share it and just bring them into the conversation. So I kind of want to talk about some general, it's sort of general and not general, but about one of the most terrifying experiences a patient can have. It's the feeling like you're falling through the cracks of the healthcare system, because when you're navigating the healthcare system, you're sick, you're not feeling well, you're tired, you might be afraid, maybe you don't have a diagnosis and you don't know why you're feeling all of these things. So it can be really scary. So we're going to cover cover a few biases. So one is ageism and why young people and it's old people too, but I'm noticing it more and more with younger people, why they're so often dismissed, what to do when you feel like you're being gaslit by your doctor. And I'm going to share some stories of what happens when the system fails. Most importantly, I want to talk about how to catch yourself kind of before you fall through those cracks. So I don't know if you've ever been told like you're too young to be sick, or if you've ever left a doctor's office feeling like you weren't believed. If this resonates at all with you, if you've got stories to share or you've got questions, please put them in the comments, because I will do my best I'd love to talk about them. I'd love to hear from you. We've had some great conversations in our past lives. So so make sure that you put those in there. So ageism is a big deal and it's been coming up a lot, and it definitely happens with older population, and like older people will hear, well, that's just part of aging, and then they kind of get brushed off and their symptoms aren't actually investigated. So we know that ageism exists with older people for sure. I'm also noticing more and more that it's happening for younger people. Like there's a pervasive and dangerous bias right now in medicine against young people, and I don't understand why that is. I guess the thinking is if you're in your teens or your 20s or your 30s, you're healthy by default. So any symptom you have is automatically filtered through a lens of, oh, it's probably nothing serious. Your symptoms are often dismissed as anxiety or stress or part of being a young person. It's very similar. The bias is very similar to when you're an older person and they say, well, it's just part of natural aging. So hi, Stacy. Welcome. I'm glad that you're here. And you guys, if you're just hopping on here, my name is Paige. I'm a nurse. I've been a nurse for 32 years. I am now a patient advocate, so I help people navigate the healthcare system. And that's what all my videos are about. So you can watch my videos and you'll see the areas that I'm pretty passionate about. My heart is not to scare people with this stuff, but it's things that I have seen in the system working in it. And I feel like it's just really important to be to kind of have that information, and so that you're a little bit more empowered and aware and all those kind of things. So that's sort of, and on my lives, if you haven't been on one, I talk through a bunch of stuff because these videos on YouTube, they stay up forever unless I take them down. And so if somebody later on is coming by and watching them, I don't want a bunch of dead space. So I tend to talk a bit more. But when I have a channel on TikTok, those ones are a lot more engaging because those videos, those don't stay up. They're not really recorded. So I'm going to be doing a TikTok one right after this if you want to hop on there. So, but I definitely want to hear your comments. And Ella, hi. Vlad, sounds like, thank you. Sarita, hi. Stacy, Power Woman, aw, you're so sweet. Thank you. I just have the best community, and I just love you guys because you guys are just really supportive and encouraging. I mean, when you're doing videos about stuff like this, I wanna be helpful. My heart is really to help. It's not to come on here and trash the healthcare system or come on here and trash doctors, because I have a lot of friends that are doctors. I know a lot of amazing doctors out there. So it's just that they're not all equal, right? And so I think it's important to empower people with some information of things that can happen. So am I a healthcare professional? Yes. So Vlad, I've been a nurse for 32 years. I've worked in critical care mostly, so emergency rooms, trauma ICU. I flew with air ambulance, and now I'm a patient advocate. So I help people navigate the healthcare system. So yeah, that's a good question. So I was just going to talk, I was kind of starting to just talk a little bit about ageism, biases. As we know, there's a lot of biases in our healthcare system, and that's one significant way that people fall through the cracks because they're judged and they're all of that. Hi, Peter. Okay, just 1 second. I'm just going to let me bear with me while I finish my train of thought, because it'll go if I don't. But I want to come back and hear your question. So like one of the key concepts about young people, and as I was saying, older people hear a lot of this, right? Like that it's it's part of natural aging. So then they don't get their symptoms treated. Well, young people hear you're too young to be sick, or you can't be that sick, you're too young, or it's all in your head, or they get gaslit and all totally dismissed, disrespected, all of those kind of things. So it's really, and there's some key concepts. So like dismissal of pain. So young people's pain, especially if they have chronic pain, it's often not taken seriously. So you're told to like push through it, or that's just growing pains. That's one big one. Another one is anxiety. So this is the most common one. If you have if you're a younger person and you show up with like shortness of breath or panic attack or heart palpitations, they say it's anxiety, it's in your head, and the end. And then you don't get those things. You're kind of like stressed out, right? You are actually anxious before the doctors even run a single test. They've decided that it's psychological. Another thing that happens with younger people is delayed testing, because the assumption is you're healthy if you're younger. And so doctors are much slower to order tests like MRIs and CAT scans, or even comprehensive blood work for younger patients. And this delay can be the difference between an early diagnosis and a crisis, right? Where it's like too late. So if you're being dismissed because of your age, whether you're young or you're older, you need to be firm and persistent and say things like, I understand that this is uncommon at my age, but what would you be testing for if I was 60? And that kind of just makes them sort of refocus on what an actual diagnosis could be. You could also say, like, I'm willing to explore the possibility of anxiety, but only after we've ruled out the physical causes. So what can we do to rule out, whatever your symptoms are? So, and then another really good one you can communicate with doctors is like, this symptom is new for me, and it's affecting my ability to work, study, live my life, whatever. And I need us to take it seriously. Like, it's concerning for me. So approaching it that way can be really helpful if you have doctors that are completely dismissing you, and just sort of brushing off your pain, brushing off your symptoms, telling you that it's in your head, all of those things that can happen. So, okay, I'm just going to scroll back here and just see, make sure. So, Sarah, my brother's allergic to gluten, lactose, if it's not organic from other countries. He's allergic to meat from the UK. Oh my goodness. He's got lots of allergies. Hey, that's tough. And it's interesting. Hi, Dark Horse. A lot more people nowadays, when I started nursing 32 years ago, I know that I'm old. That's like a long time ago. I get it. But when I started nursing, people didn't have allergies to everything. So it's really interesting how allergy, and they're really significant. They really affect people. I'm sorry that your brother's going through that, Sarah. That cannot be fun. KQ, hi. Meat from other countries is safe. That's interesting. Oh my goodness. I don't look 60, I look 16. Regio, thank you. You're my new best friend. No, thank you, because I'm not 60. I'm a few years below that, but look, 16. That's amazing. Oh, you guys are awesome. Thank you. Paul, I have carotid plaque and hypercholesteremia. So that's like high cholesterol for those of you who don't know, and some plaque on his arteries, doing a vegan diet and taking statins. Good. Well, I hope that helps for sure. That should help. Yeah, hopefully that they're kind of on it, and it sounds like they are if you're taking some statins. So thanks for sharing that. Yeah, that's great. And I think there's definitely, and I think each human is different too. So as far as diets go, I think for some people, a vegan diet can be really good. For others, not so much, right? So it just really depends on the person and what your kind of genetic makeup is in your DNA. Peter, you have phlegm stuck in your chest. Don't get up. Have medicine from the doctor and it's not good. So you've got like it's like stuck in your chest. Yeah, I'm not really sure. I mean, that could be a million different things. I'm not a doctor, right? I'm a nurse. So I would maybe check with your doctor to see if there's something you can take to loosen that up, because you don't want that turning into like a pneumonia or something. You might want to try like some steam, just get some steam going and some humidity to try and loosen that up. But if it's been going on for a while, if you are having problems breathing, if you have a fever, any of those kind of things, I would definitely just go get that checked and make sure you don't have like a pneumonia setting in. But like I say, I'm not a doctor, so I have to be really careful what I say on here. Ginny, hi Paige, I love your videos. Oh, thank you so much. Thanks, Ginny. I really appreciate that. It's really encouraging when people say that, because it just, yeah, I obviously want to be helpful. And so I'm glad to hear that some of my videos are helpful. I have gotten people say like, you're kind of freaking me out here, Paige, with some of your videos, but my intention and my heart is definitely not to scare people. It's really just these are things that I've seen. There are ways that I've seen people fall through the cracks in the system. And I just think it's, I want people to know kind of what to look for. And it doesn't mean when you're navigating the healthcare system, you're like on edge all the time or paranoid, but it's just kind of to tuck it away in the back of your head and just sort of so that you're a bit more aware of things that can happen in the healthcare system, so that you're a bit more equipped. And then hopefully it can maybe prevent some people from falling through the cracks. So that's my heart for sure. If you're just joining on here or you haven't been on one of my lives, I actually lost my voice for about a week over Christmas, so I wasn't able to do any lives. It was weird, actually, like just totally lost my voice, and I wasn't sick or anything. So it was very quiet, a quiet Christmas. But anyways, yeah, so I have been a nurse for 32 years. I've worked in emergency rooms. I've worked in ICU, like trauma ICU. I've flown with air ambulance. I've worked a little bit in operating rooms, recovery rooms, some outpost nursing, like remote nursing, a little bit of everything, but mostly critical care. And now I'm a patient advocate, so I help people navigate the healthcare system. So yeah, so that's kind of the gist of that. Okay, Paul, what specialty? I'm not sure what you're asking. Plaque. Doing vegan diet. I'm not sure what you're asking about what specialty. Maybe you can clarify that. But I would think that you would see a cardiologist, probably would be a good thing. Or, I mean, your family doctor has probably ordered you your statins and stuff. Peter, yeah, your doctor have look on that. Yeah, for sure. It's definitely worth looking. Definitely worth looking. David, I see your comment there. I cannot speak about certain drugs on here or I'll get booted. So I just have to be really careful where I go with that kind of stuff, where, yeah, through anything to do with sort of addictions and that kind of thing. Jen, the healthcare system killed so many of my friends and family. I'm really sorry. It is really... we just had a really unfortunate event, up in Edmonton in Canada, and it's just, I'm really sorry that that's happened. And sadly, people are falling through the cracks, and diagnoses are getting missed. And so I'm just really passionate about advocating for yourself. And it shouldn't be that way. I get it. It's not fair. It shouldn't be that way. We shouldn't have to take this on ourselves. We should be able to trust the people who are supposed to care for us, right, when we're sick. But unfortunately, we kind of have to be our own quarterbacks right now and take that on. And so is it fair? No, but it's kind of, what are the options, right? And it's disheartening too, and it can be really traumatizing because like people who have been dismissed or have had experiences that were not positive in the system, they can get PTSD, like medical PTSD from the medical system. And then who do you trust, right? Who do you trust moving forward? And it's really disheartening. It's scary and all those kind of things. So I'm really sorry, Jen. Kai Hoffman. No, I'm not a doctor. I'm a nurse. I'm a nurse and I'm a patient advocate. So Point Fire liked. Oh, best wishes from Toronto. Good to see you on here. That's awesome. You say one of the richest country on earth, but we have one of the worst healthcare systems on earth. You know what? Yeah, all of North America, Canada, and the US, we are pretty far behind. I would have to agree with you. We are, and in Canada, it's a free system, but it's very, very basic. And that causes a lot of issues as well. And yes, we are fortunate because some things are paid for, but our wait times are pretty crazy, for sure. You literally are buying your own health. Yeah, Balkan. Yeah, for sure. It's true. It's sad, but it's true. Why don't you have universal healthcare like we have in Sweden, right? Yeah. So Sweden, you guys have an incredible system there. I kind of wish all of us would have that same system. Louise, hi, welcome. If you guys are just joining on here, so oh, Karen, you're from India. Okay, perfect. That's great. Thanks for chiming in on that. If you're just joining in, I love questions. If you have any questions, if you have any experiences that you want to share of your, like the ways that you've fallen through the cracks or a loved one in the healthcare system, I'd be happy to talk about that. I've got some topics to talk about as well. I was talking a little bit earlier about biases that happen in our healthcare system, and there are a lot of them, a lot of different kinds of biases. There are age-related ones, which I spoke about. There's sex-related ones, gender. There are like socioeconomic, racial biases. There's just so many of them. So yeah, it's tough. It's tough to navigate, and to learn how to communicate against that so that you still get care it's a bit of a skill. So okay, I'm just going to scroll and look at some comments here. Barrett, hi. You've had the same first doc diagnosed lung pulmonary, new doc diagnosed congestive heart failure. Oh, interesting. Yeah, that can happen too, where you get these different specialists involved, and you get two different opinions. And I've seen people that have 2 or 3 different specialists. They all give a different diagnosis. They all give different medications. Sometimes those medications don't work together. And there's nobody really, kind of at the hub of the wheel of that. So, yeah, that's really interesting. Very interesting. Thanks for sharing that, Barrett. David, if the government's paying for healthcare, you should be able to select what you want. Absolutely, you should. However, there aren't enough resources. Like, it's just way overstretched. There aren't enough doctors. There's actually fewer doctors graduating from school right now than ever before. Well, I don't know about ever, but definitely in the last 50, whatever, longer years. I can't say how long it's been, but it's pretty significant right now. And so then that trickles into the rest of the system, right? So then that means so fewer doctors, that means more patients in hospitals, in emergency rooms, less beds in emergency rooms. Also, our baby boomers, right, are getting older and accessing the system more. So that's, I agree with you. We should be able to just get the care we need, but there just aren't resources. And so the wait times, one of the biggest issues in Canada are the wait times. They're excruciatingly long. And so then people are waiting for tests, waiting for specialists, waiting for surgeries. Meanwhile, maybe they've got brain cancer that is just growing, right? Or they've got things going on that just are getting worse. So yeah, it's pretty dire. And I worked in the hospital for 25 years in emergency rooms and ICU. And I'll tell you, and now I do my patient advocate work. So I'm out of the hospital, but to go back in the hospital right now would be tough. So I do really feel for the nurses that are still in the hospital setting, because what do you do with limited resources? So anyway, I went on a little bit of a tangent there. I do that sometimes. Stacy, you don't like doctors. Fair enough, for sure. There are a lot of really great doctors out there. Sadly, they're not all equal. They don't, even though they all go to the same kind of school, they're just not all the same, and there aren't enough of the really good ones, in my opinion. We're proud to have good health care, and we take care of elderly people. That's awesome. Yeah, I think you said you're in India, did you? Yeah, you're in India. That's amazing. And it's a cultural thing too, I think. In some of the like in North America, parts of Europe, like it's different culturally in India, in China. I've had clients in both of those countries, and there's more of a I don't know, like more of an importance put on seniors and elderly, and there's more kind of family system caregiving. And whereas here in North America, we're all just so spread out. Like families are just like, miles and miles and miles apart. So, Louise, you live in the UK. Oh, interesting. Natural, Basilia, natural versus synthetic for healthcare. Yeah, interesting. Yeah, you know what? A lot more people are going towards, they're still using some Western medicine, like classic kind of wet medicine. I can't even talk. But a lot are going to naturopaths and kind of going a more natural route. And I think it's amazing. Like I've seen some really great results. The unfortunate part about naturopathy is that it's often expensive, right? So it can cost a lot. So, but yeah, I think it's great. Belkin, you had 2 surgeries and you paid 0 money for that. Yeah, interesting. That's so in Canada, surgeries are free as well. But and in the States, it depends. If you have insurance in the States, then it pays for it. If not, then you pay out of pocket. The problem in Canada with the free system is that there's long wait times. So you could be waiting years to get a surgery. It's pretty bad. So a lot of Canadians are actually going to the States right now to get surgeries and treatments and tests. Anyways, and hi Alice, I'm glad that you hopped on here. And if you know anybody who would benefit from this, just share this. It will stay up on YouTube after as well. So you can just send it to them. And I'm always open to, if you guys have ideas for videos or anything like that, or you want like, hey, I've got a group of people that really wants to have a live session with you, I'm happy to do that. If just message me on here. I also have a TikTok channel. And so, so you could hop on there and find me on there too. I'm also an author, so I just want to explain this quick. My channel says Paige Lennox Books and Patient Advocacy. So I am an author as well. I've written a bunch of books, but so this channel was supposed to be about my books, and then I wrote my healthcare book. It's a guidebook. I'll show it to you here in a minute. And then some clients were just saying, well, can you put some videos up about this? And then it morphed into this, but I didn't want to change the name because I had some people on there already that were following me for the books. But anyway, so it's a little confusing, but whatever. I guess people will find me or not. But anyway, this is my book. It's Canadian. I've been thinking about writing one for the States and one for Europe and one for India. I don't know. Anyways, I got to work on, I have to see if it's worth me putting the time into, because it's a lot of work, but this one's Unlocking Canadian Healthcare, and it's a guidebook. So it's not a book that you read start to finish. It's got, I'm really nerdy, so it's got it's all color coded, but I'll just show you quick. But it's got chapters, right? So you pick, so it's got how healthcare works, know your patient rights, navigating mental health and addictions. There is LGBTQ, newcomers to the country, like where English is a second language. There's Indigenous health, rural, like remote health, seniors, end of life, caregivers. So there's kind of a chapter for everybody, and some of it's just, you could probably relate to a few of them. And then you basically just go and find the color in the chapter. And there's tons of resources. Like I've got resources for every province, and places to write notes and whatever. Anyway, the link, it is on Amazon. This isn't a pitch for my book, but I've been thinking about writing one for the States, I don't know, as a starting point, but let me know. If you're from the States and you think that would be a good idea, let me know. Okay, I'm gonna just scroll a little bit. In Sweden, you have guaranteed health care from newborn babies to 100 years old. Oh, wow. That's so cool. That's just so cool. I think that's the way it should be. People in the States are like, yeah, that would be great. I'm curious, with that kind of a healthcare system where in Sweden, where it's universal, is there enough resources? Like, are there enough doctors? Are there big, long wait times? Like, do you have to wait forever to get like an MRI or to see a specialist or have a surgery or something? I'm kind of curious about that, Balkan, if you could... Yeah, or if anybody knows about that. Okay. And if you're commenting on here and it has nothing to do with what we're talking about, I'm just going to scroll. Hi, Stacy again. Oh, thanks for the likes, you guys. It's encouraging when I'm talking and somebody likes something. It's kind of encouraging for me, but so I appreciate it. Alice, hi. Balkan, come and visit Sweden and you will not be disappointed because you work with health. Yeah, I have a couple of colleagues that I worked in ICU with, and they went to Sweden. They went on a vacation, but they toured some of the hospitals and they came back and they're like, Paige, we gotta try and get that in North America. But yeah, really good care. Okay. Free is not free. You pay for it with taxes. You do, Basilia. Yeah, absolutely. I mean, it's not just it's not like in Sweden, like that's just kind of a basic right that you have there in true universal medicine. In Canada, we are, it's kind of hybrid actually now. Like I would say, I don't know, maybe 30% of our system is privatized now. So it's sort of moving a little bit more to the private, but yeah, but you're right. We still pay taxes and we still pay like each province, if you're not from Canada, each province has their own kind of system. So you pay monthly into the provincial healthcare tier or system. So it's not totally free. Balkan, I know everywhere there's a long waiting time. This problem, you even have it in Sweden. Yeah, and that's the downside, right? That there's there's always. Okay, Mark, you can stop. I'm just gonna ignore some of you. Like, we're trying to have a conversation here. It's about people's healthcare, and healthcare is vulnerable. And when people are sick and they might be scared, it's a vulnerable thing to talk about. So I would prefer it if you could respect that. Thank you. Thank you, Soya. See if I can say your name right. Soyash. Did I say it right? Oh, I feel so bad if I can't say your names right. Abdul, do I trust ChatGPT with your medical symptoms? I would say yes and no. I mean, when you're looking online, you want to be careful of your sources, right? Where you get your information. Like there's some that are really reputable and that are reliable. And there's some that aren't. So the problem with ChatGPT is it scours all of them. So it kind of picks up from different places, different information. So yes and no. I mean, I wouldn't believe everything that you see on ChatGPT, because I think it's also, because it's AI, it's also trained to sort of support what you're talking about. So if you kind of say, I had this pain, it's getting worse, I can't sleep, it'll kind of go towards a diagnosis or a suggestion that is maybe worse than it is or less worse than, I don't know if I'm making sense. But I would say yes and no. It doesn't hurt to go on there, but just be kind of careful of your sources. Like the Mayo Clinic is a good source. Like there's a few that are good and reliable, so you could always double check it with some of those. So so yeah, we don't need to know. I don't know how to Mark, you can stop now. I don't know how to, on TikTok, I know how to take someone off. I don't really know how to do that. Let me just, bear with me 1 second. Let me just see. Sorry, guys. And if you're watching this in a week or 2 weeks, I'm sorry. Oh, there we go. Okay, I think I fixed it. Okay, here we go. Hope I didn't erase anybody else's. Sorry, guys, if I did, but anyways. I apologize if I think it's still good. Okay, you have friends and family in Canada, beautiful country, never visit, but you would like to do that. Absolutely. You should totally come. It's a great Becky, have you had fun? Oh my goodness. Victoria, okay, yeah, I think I did. I think I blocked it, okay. And if so YouTube lives, they stay up for quite a long time, like they stay up indefinitely. So if you're watching this later on, there was somebody on here that was being quite rude and disgusting, so I was trying to block them. Anyways, if you're kind of wondering what's going on. And I'm reading people's questions and comments and kind of speaking to that. So, okay, Balkan, yes, we have problems with long wait times. It's crazy in Sweden. Yeah. I think it doesn't really matter what country you're in. Unfortunately, I think it's a global. I had somebody reach out to me from Iran, and then also Australia actually, and it's just a everywhere problem, unfortunately. And I think the pandemic didn't help either. We're screaming government to employ. Oh, you're wanting to employ more doctors and nurses. Absolutely. However, there's fewer people graduating from medical school and nursing school. So I think it's a bit discouraging. Like for most of my career, if somebody younger came up and said, hey, I'm thinking about going into nursing, what do you think? I'd be 1,000% yes. It's a great career. There's lots of different options. There's lots of flexibility. You can work. Like there's so many different areas, right? Right now you can even do telehealth, you can do travel nursing, you can go work on a cruise ship as a nurse, you could work in a hospital. So there's all kinds of stuff. Now I'm sort of like a little less enthusiastic, I guess, because it's hard. Like the staff are just overworked, and I don't really know what the answer is. I don't have a solution. I just know that I think patients need to be really cognizant and aware of sort of the things that can happen, just so that you can really, and not to be in fear, not to walk around paranoid or anything like that, but just to be aware. And I think that's empowering, right? When you're cruising through the healthcare system and you're sick or you're kind of trying to navigate it, then it's like, okay, I need to watch for this. Or if you're feeling dismissed or any of those kind of things, right? Or you need a diagnosis and you can't get one. There's so many ways that people can fall through the cracks, as most of us know. This is a problem in all of Europe. Yeah, for sure. It absolutely is. Mark is sick, Becky. Yeah, I know, hey? Hi again, Alice. Healthcare is most valuable for everyone. Well, it is, and it's something that we all have in common, right? Like we all have physical bodies and it doesn't matter what country we live in, our physiology is the same. Everything works the same. And so we have that in common. It doesn't matter if you are unhoused and live on the street, or if you're like a multi-billionaire. Our healthcare is healthcare. Our body is body. Sickness is sickness. So yeah, it's valuable to everyone. Okay. I think I got rid of most of Mark's comments. Alice, are you happier now you've left the health system? Well, Yes, I would say yes. I did it for 25 years. I did it a long time, and I did critical care, which was pretty intense. And so I flew with air ambulance for quite a while too. I am and I'm not. Like one thing, I've always been a natural advocate. Like I've always wanted to just advocate for my patients. If I saw something that I didn't think was right, I would like write it on a napkin. But you're a bit confined, right? When you're working in a hospital as a nurse, because you've got to follow doctor's orders, hospital order, rules, the administrative rules, your nursing body. So you can't just go around giving, kind of counteracting what a doctor says or what another nurse says or whatever. So I've always felt a little bit confined. So this is very freeing for that. I can kind of help people because I know how the system works. I know how things are supposed to run. So I can kind of go in different angles. So I'm still in healthcare. I'm just sort of in it in a different capacity. So yeah, but that's a really good question. No one's really asked me that. I think I would prefer to not have to work in the hospital again. That would be my preference for sure. Just because they're just overworked and even towards the end. So I stopped working when the pandemic came. I was still working in the hospital part-time. I was doing my business part-time, my patient advocate work. And then I decided, you know what, this is a really good time for me to not be in the hospital anymore. And I went full-time in my business. But at that time, it was starting for a few years prior to that. You go to work and you're like, kind of say a little prayer, like, oh, I hope I don't lose my license today because something goes wrong. So it's unnerving for staff, I think. Oh, Wilhelm, from the UK. That's awesome. Okay, is there any research on the effects of long-term daily cannabis use? There probably is. I'm not super familiar with it. Yeah, there probably is, Jimmy. I'm not 100% sure though on what that is, but I would think it would be fairly easy to find that. And yeah, it's been used long enough that I don't know. I guess what is long term? I mean, it's not been a common thing for 100 years or 50 years, but I think it's been used long enough that there should be some semi-reliable research. I know that there is some. I just don't know offhand what that is or where that is. Okay, I was shocked at the workloads pushed on nurses, filling prescriptions and dispensing medications as they were responding to patient alarms. Right? Like all it takes, that's a really good observation, Point Fire, because if anyone else on here has even stepped foot in a hospital or onto a medical ward or whatever, it doesn't take long before you see what's going on. Like the beds are all full. There are patients lining the hallways and they'll just put like a divider and that's your room. Like you don't even get a room if they're full. There's call bells going off, people yelling, nurses trying to answer calls. And yeah, you're absolutely right. Trying to give medications. It is, they're just overstretched. And the patient to nurse ratio is way off. Like it's way off right now. I don't know. Every department is different. So I've worked mostly critical care. So it was sort of the sickest of the sickest people. So it was often one nurse, one patient, or one nurse, two patients. But on the medical and surgical floors, like on the regular units, it's obviously more patients to one nurse. But I know that ratio is not very safe right now. You're right. That's a really good point. Becky, I love your comments. Oh my goodness, you guys, okay. So for people like Murphy, people that are talking about all this kind of stuff that has nothing to do with what we're talking about, this is a chat. We're talking about healthcare. We're talking about navigating healthcare, ways that people fall through the cracks. It is something vulnerable. It is something frustrating for people. It is scary for people when they are sick and they can't get the care they need. So I'm going to ask again if you would please respect that. Because this is meant to help people. It's not meant to just be a joke. There. That's all I got to say about that. Okay. I'm just scrolling here to see. I'm just gonna take care of that one other person here. I think I'm getting used good at this now. Okay, I did it. Oh yeah, I'm getting quicker and quicker. One more, sorry guys. Okay. Do you agree? Let me just, if I missed anything. Abdul, do you agree with third-party RX? For me, RX is a medication, but maybe if you, advocacy, third-party RX advocacy. I agree with any kind of advocacy, honestly. And I don't know if you mean like third party. What I can tell you is that as soon as there's a third party involved, so not just you and the doctor, patient and doctor, and a third party can be anybody. Basically, an advocate can be anyone that has your back, anyone that has your best interest at heart. As soon as there is a third party involved that is not aggressive and not being nasty, the dynamics can completely change, because all of a sudden the doctors, more accountable. They might think more before what they say. They know that there's another person watching. Your third person or your advocate can take notes for you. They can be another set of ears to kind of witness and hear what's going on. They can help you ask questions that you might forget. Another really great one, if you've got a doctor that's been dismissing you or not believing your symptoms, your advocate or your third person, they can have your back. They can say like, actually, Susie hasn't been at work all week because of her pain. Or actually, I saw Tom like fall down because he was so dizzy. Like they can kind of validate some of that. So I don't know if that's what you were talking about, Abdul. If not, I went on a tangent by myself, but that's just what happens. Okay, Balkan, when you walk out of your home, are you insured? And if you break an arm or something like I did, still had work when they came back. So yeah, I mean, most people, actually, it just depends. If you work in a job where they have benefits, where they can cover that kind of thing, then you would be covered and insured. If you work in a union of any kind, and so that's often service type jobs, like nursing is part of a union, then they are obligated. If you go off, if you're injured or you're sick, then they have to hold your job for you. So so it just kind of depends. It's not like I think for you, what you're saying is everybody has the same insurance. It's not like that in North America, Canada, or the States. Okay. I have great respect for you nurses, especially what you sacrifice under COVID. Oh, thank you. Thank you so much. Becky, I think Mark and Murph have been in contact. Oh my goodness. Okay, Storm, tell them to go to their doctor and get checked for a reason for their problems. I think you're talking about the people that yeah. Legalese, do I read TikTok comments? I do. I don't know if that's what you're asking for sure. I'm kind of reading between the lines. I do have a TikTok channel. I'm going to do a live right after this. So, and those ones are often a bit longer. They're a little bit more. On my YouTube videos, I try to keep talking if I can, because people, they stay up on my channel. So people that might come along in 2 weeks, they might watch this. And I don't want a bunch of just sort of quiet space. So, but TikTok is more just, I hardly ever tell my own stories on TikTok. It's just usually, and this is great. This is an awesome live with you guys because you're participating, which I love, and you are sharing experiences, commenting. You're having my back with people that are saying crazy, kind of crazy stuff on here too. But you're sharing stuff, you're being vulnerable. Some really great dialogue, and that's what I want. So thank you for that. That's so great. Okay, Balkan, I have family members in healthcare, both doctors and nurses. May God protect you in difficult situations. Thank you. Yeah, but you know what, Balkan, like, I don't know what you do for work, but everybody has their own gifts, their own skills, things that they're drawn to. Like, there's some jobs that I could not do. Like, I couldn't do it. So I think we're just all made a little different, and that's why we all are good at different things. So But thank you for saying that for sure. I really appreciate that. And that's partly why I guess it burns me so much when I see healthcare workers, judging patients or dismissing them or gaslighting them or otherwise traumatizing them, rolling their eyes, sighing, like, oh, there they are again, all that stuff. I don't. Healthcare, I mean, that's humans. I understand that humans can just do stuff like that. However, in healthcare, we take an oath to do no harm, and yet this stuff is still happening. I just don't think there's any room for biases and judgments and prejudices and those kind of things. People are too vulnerable. They come and they're not feeling well. They're hurt. They're scared. They're overwhelmed. I just don't think that there's any place for that. So that's if the restrictions were gone, would you go back? Oh, to the hospital? I probably would. I don't know how restrictions could go though. I mean, during the pandemic, that was kind of a very unique situation. But I think that nurses will always be sort of, I don't want to say subordinate, because a lot of doctors respect nurses and I respect nurses. But we have to follow doctors' orders, right? And there's certain things that we have to do. So those kind of things, which is fine. Like, I have no problems with hierarchy and the way things work, and they have more education, they're skilled in certain areas. So, I would go back. I don't know if I'd love shift work again. I did it for 25 years. So, but yeah, I didn't dislike, I loved it. Actually, I really loved it. But I love what I'm doing now too. So, I don't know. Okay, this is so great, you guys. Every government must invest more in doctors and nurses, education, and new technology, not in fancy, expensive buildings, for sure. And it'll be interesting to see what happens with AI too. How that plays into things. Cool dude, hi. What happens to the needles after they leave the hospital? I don't know what you mean by that. I'm thinking like. The only needles I think you might be referring to would be for insulin or heparin, those teeny weeny ones. There's ways to properly and safely dispose of them, and people are taught on that. Okay, legals. Okay, I made an agreement with myself to not talk about the pandemic as far as which side of the coin I am on, or in the middle, or I try to, on this channel, I am staying neutral. So, I'm gonna just not answer that, sorry. Yes, Becky, for sure. MTC, quite bad, actually. I think Mark is a different Mark. And people think doctors are the problem. The actual problem is the insurance companies, not the staff on the ground. So much misdirected hate against doctors and nurses because people don't understand. For sure. I mean, insurance companies. So that is in the States a huge issue, for sure. And the insurance companies, obviously, they don't want to pay. So then they resist and they hold back and that kind of thing. So in Canada, it's not that isn't the issue. It tends to be more like doctors resisting or whatever. So, but yeah, I hear you, Mark. Like there's a lot of awesome doctors. I know a lot of them. They're incredible. They're not all the same, just like every hospital. Some hospitals are amazing, some are not so amazing. So, but yeah, thanks for pointing that out. And insurance companies, it's like they're paying out of their own pocket sometimes. So yeah, that's tough. Okay, I'm just scrolling here. Remember the scientists in the hospitals. Yeah, do you mean like in the labs, Alice? Like the people that in the pathology department, probably. Absolutely. I mean, the hospital, it takes the whole, it's a whole system. It literally is, even the healthcare system. But within a hospital, there's so many departments, and none can really work without the others. So I love that. It's not in Sweden. Everybody has the same. Yeah, Sweden is such a unique healthcare system. Like everyone is equal. Everyone's the same. So interesting. Okay, Mr. Young, that's great. Oh my goodness, what is people's obsession with diarrhea on here today? This is kind of funny. Okay, Balkan, every government must invest more money in research and education and new technology, not in big shiny buildings. Yeah, I think I read that already. So anyways, okay, I'm just gonna stay on for about another 5 minutes, you guys, and then I'm gonna hop off because I have another live that I'm doing. I mean, you as a backbone under COVID. For me, you are real heroes. I mean that. Oh, thank you. Thanks so much, Balkan. I really appreciate that. I will pass that on to my nursing colleagues and friends for sure. Oliver, yeah, I don't have moderators on here on YouTube. I haven't done that yet, actually. I haven't done enough. It's taking longer to get some really good dialogue and engagement on YouTube. My TikTok channel, I have a few moderators on there because it was a little faster to build. But now, yeah, I think I should look for one. So, because I'm trying to do it myself, the moderating, and I'm not that skilled at it, and it's a bit distracting too. So, okay, pay for money and food in abundance. Okay, this is getting a little crazy. I know, Tilda. It's kind of. It is distracting. You're welcome, Alice. Yeah, you're very, very welcome. Becky, I watched half of your patients pass of COVID. Oh no, I'm so sorry. Oh, that was such I'm assuming you're a nurse or you work in healthcare. Oh my gosh, I'm very sorry about that. That is tough. It was hard. It was really traumatic on a lot of staff, for sure. Balkan, many people believe in conspiracy theories instead to ask doctors and nurses for advice. Yeah, that's a whole other thing. Paul, where are the mods at? I know. I haven't figured out how to get a moderator on here yet. So I haven't needed one until today, this live. My other ones they were kind of mellow. So I've just kind of been doing it myself. But yeah, I should probably find someone. USA should change the law not to benefit insurance companies, but benefit the people. Absolutely. It's just kind of like, yeah, I know I need moderators. Yeah, I think it's healthcare is a big business, right? So it's about money and resources and control. So anyways, okay, you guys, so I'm going to sign off. And thank you so much for participating. Thank you so much for your likes on here. If you haven't subscribed to my channel, go ahead and do that. I usually post, I don't know, like 2 or 3 videos a day. They're just short ones on different topics on patient advocacy, navigating the healthcare system, and that kind of thing. So go ahead and subscribe on there. If you are interested in my book, it's on Amazon. The link, I have it in all my descriptions on my videos. It's probably in my bio too. I actually can't remember, but yeah. So anyways, thank you so much. And if you want, I am gonna be probably in like 15-20 minutes ish. I'm gonna be on TikTok as well doing another live, and those ones just look a little bit different than this. So anyway, thank you so much. I really appreciate you guys. I appreciate your comments, and I'm going to figure out how to get a moderator. When I do enough lives where I have regular people, like on TikTok, I have a few regular people that come all the time. And so they just offer and they're like, I'll just do it. But I'm just kind of hasn't got to that on this channel yet. So thank you. I love you guys. Thanks for participating and for joining me on here, and have a good rest of your Sunday.